Hello. So let's continue on our session on diagnostic tests for infectious diseases. We were discussing about the cultures, its advantages and limitations. Let us see about cultures in detail. Cultures followed by antimicrobial social testing. Culture depends upon the choice of culture media and clinical prescription, microscopy, and susceptible pathogens. Methods of culture include conventional methods like in-house prepared blood culture bottles or commercially procured, and automated systems include BacTBD or bacterial 3D or versatile. The methods of cultures include qualitative methods like presence or absence of growth, or semi-qualitative where we do the colony count in terms of colony forming units per ml of sample, or where we do quantitative methods like where an absolute number is provided. There are different conventional culture methods available such as blood cultures, microbacterial conventional cultures, fungal and other samples cultures. Well, blood culture takes about 2 days for provisional report, about 5 days for final reports. Microbacterial takes about 4 to 6 weeks for isolation and then 3 to 4 weeks for identification and sensitivity. While fungal it takes 2 weeks for identification and sensitivity. A dermatophages and systemic dimer takes about 2 to 4 weeks for identification and sensitivity, while other samples takes about 24 hours for isolation and 24 hours for sensitivity testing. Early pathogen identification is very essential. For every hour delay in the initiation of antibiotic treatment, the patient survival declines by 7.6%. Empirical and broad spectrum therapy is uh, should be rational. A delay in the pathogen identification causes a delay in the targeted therapy. 50% of the bird stream infection and 70% of the fungi may receive incorrect therapy during empirical treatment. There is a need for automation to reduce mean time for pathogen isolation by continuously monitoring of bacterial growth. It is to reduce the mean identification time for organism isolated and susceptible result. How is the workflow? The automated culture systems are available. Blood culture flags positive, then we do the microscopy, and either we go for the rapid sensitive testing or subculture it and then proceed for identification sensitive. The difference between conventional and automated methods are conventional is less sensitive, however more false positive, cheaper, daily once or twice checking of the growth is required, no maintenance, no electricity, no continuous supply of electricity is required. It's good for smaller workload labs. Automated blood cultures is more sensitive, less false positives, however it is expensive maintenance, continuous electricity is required, however it is good for good load of labs. Regarding cultures, the advantages is it access to live microorganisms, ability to recognize viable cells, easy to quantitate the cells, high sensitivity. While disadvantages is the risk of contamination, high skill is required, time and resources are intensive, and relies on phenotypic biochemical. Let us see about sensitivity. Why sensitization is required? It is required for the selection of appropriate treatment. It is required for monitoring of the development of the resistance. It is required for detection of new resistance mechanisms. Then to compare trends among different geographical areas and healthcare facilities. Then it is required to develop and evaluate interventions and preventive strategies. So sensitivity plays a very key role in our fight against antimicrobial resistance. Key terms using sensitive testings. One is MIC, that is minimum inhibited concentration. It is the lowest concentration of the antimicrobial that inhibits the growth of the bacteria. It's really from the patients. Breakpoints. Breakpoints are a lab-defined concentration of antibiotics at which the drug is expected to either inhibit or kill the growth of bacteria. These breakpoints are used to determine whether a bacteria isolate is susceptible or resistant to a particular antibiotic. The concentration range decided for a drug and the interpretation criteria for various categories of antibiotics are based on extensive studies that correlate with the serum achievable levels, particular resistance mechanism, successful therapeutic outcome. Practical solutions, the entire range may not be used for decision making. Hence, the breakpoint is needed for categorizing the MICs. The most important is the susceptible breakpoint to MIC ratio, which is used for the selection of the antibiotic. Then we have the term called as mutant prevention concentration window selection window. MPC. MPC is defined as the concentration of the antimicrobial that is prevent the selection of resistance bacteria. It is higher than the MIC and is considered to be the critical threshold for preventing the resistance. MPC is based on the idea that exposure of bacteria to sub-inhibitory concentration of antimicrobials can select for resistant mutants, while exposure to concentration above the MPC will prevent the selection and evaluation of resistant bacteria. There in this chart, we can see there is a mutation selection window which is higher than the MIC, and it is used for selection of the resistant subpopulations. What are the phenotypic methods available in sensory testing? One is the broad microdilution, disc diffusion, gradient testings, agar dilution, chromogenic media, and semi-automated devices. But the molecular method includes PCR, cycle sequencing, and NGS. But the protein methods include multitude of. Choosing the right testing method is essential, and it depends upon the performance, flexibility, adaptability, and the cost, the reliability, reproducibility, accuracy, and performance preference. Only few methods have been shown to be reproducible and repeatable. This includes disc diffusion, MIC testing, and E-test. And we have seen that there are different methods available now. Let us see the unique features of these testings. In disc diffusion, there are discs with fixed concentration of antibiotic that is used. It is a quality method of sensitive testings. The inhibitor zone, the zone of clearing is the antibiotic criteria, wherein the zone of clearing is used to either categorize the antibiotic as sensitive, intermittent, resistant. It provides less reproducible data. While agar dilutions is provided as the MIC, it is quantitative method of sensitive testings. Inhibitor concentration, that is minimum inhibitor concentration, is the interpretive criteria, and it is a gold standard of the sensitive testing, that is agar dilution or broad dilutions. E-test is again a combination of the disc diffusion as well as the MIC. It is easier to perform. Paper strips impregnated with the concentration of the antibiotics are used. It generates MIC value. That is about the E-test. Regarding automated microbial system, this is used for identification and sensitive testing. It is an advanced method. A broad microbial dilution method is the principal. It is quicker and it provides detailed antibiogram. So that was about the various tests employed in microbiology for sensory testing. The automated system, the advantage is that the identification time after culture positive is reduced from 32 hours to nearly 6.5 hours. The mean time to sensitive testing is reduced from 40 hours to 23 hours. The time to therapy adjustment is reduced from 75 to 30 hours. The mean hospital cost per patient is reduced by 30%. You can refer to the article Infection Control Hospital Epidemiology for the details. Automated system, it is an improved identification linked with sensitive testing, standardization of endpoint readings, improved results, the speed, then increased number of antibiotics tested, embedded expert rules, a lab workflow is managed, and epidemiology software is present. Then we have genotypic testings too. We have seen phenotypic testing. About genotypic testing, we have next generation sequencing, we have microarrays, and genetic analysis. We get a resistome or resistant profile of the microorganisms in genomic testing. Now, which method to apply, whether phenotypic or genotypic? The advantage of phenotypic testing is it is universally applicable. It is mechanism independent. It gives an exact phenotypic categorization, and it has therapeutic relevance. However, the issue with the phenotypic is that it requires time for the growth. It is expression dependent. Hence, genotypic method is at times preferred because being rapid and it can also confirms the resistance mechanism. However, the issue with the genetic method is that in negative does not necessarily mean susceptibility. In positive does not necessarily mean resistance, and it is limited to very few antibiotics. Then we have mass spectrometry, that is MALDI-TOF. It is matrix associated laser disruption ionization time of flight. Rapid identification of bacterial, fungal, parasites, and other viruses from the culture plates, microbiota, and other first stage organisms is easy with MALDI-TOF. It has a protein pattern matching. It's based on proteomics. When there is a protein pattern matching is done to identify the bacterial organisms. More accurate than its conventional methods, faster and lesser expensive than 16S DNA sequencing. Sensitive testing is done by detection of the resistance genes. Advantages of MALDI-TOF is that it is suitable for high throughput testing and may be completely automated. Identification is in within minutes. Its compliance systems are available. This detection does not require pre-analytical separation steps. Limitation of this MALDI-TOF is that it necessarily requires colonists to obtain wholesale or extracted protein specimens with a minimum number of polyformic units. In mixed culture, it will pick up the dominant organism. Very rarely detects all. Change in the environmental condition for the growth of the bacteria can produce different spectrum, causing false positive results. Database is very. That was about the principles of a diagnostic test for infectious diseases. The take-home message is that right specimen collection and test order is crucial for correct diagnosis. Microscopy is less sensitive but specific in sterile fluids. Microscopy provides rapid diagnosis. Microbial cultures are still gold standard, and culture provides isolates for antifungal sensitive testing only after considerable delay.